Your skin and your hair, they actually reflect what's going on deeper inside your body. PCOS is not just a problem with the ovary, it's actually a tip of the iceberg. There's a lot which is going underneath. There is more at stake. And I'm saying this on record.
So when is period pain not normal?
In case you need to take a painkiller all 5 days, 3 times a day, please get it investigated. The point which should be made very clear to every woman, biologically, we were made for a different kind of a planning of pregnancy. We were designed to be pregnant earlier.
For women after menopause, what health risks become real?
The damage starts to happen much earlier, before the menopause. We blame menopause for everything, but nobody blames their lifestyle. And I really think people are at a bigger problem because they think कि मैं तो छोले भटूरे खा सकती हूँ. There is no problem. Have you ever seen an animal in a jungle fat after dinner?
Welcome to the Odds Fitness Podcast. Today we have Dr. Anjali Kumar, who is one of India's leading gynecologists and obstetrician. She has more than 35 years of experience. She has this amazing platform called Maitri, which is WHO approved, which was also something new and unique to me, and where I told her we aspire to be there someday. All organic, all authentic. She's one of those few people. I've been speaking to her for a while before this podcast, and she's very particular about the kind of information that goes there. Not commercial, very authentic, very organic. I really encourage you to follow her page for all those women who are actually trying to lead a healthier and a better life, and for all those problems that you might not have answers to. She's also laparoscopic, advanced laparoscopic and robotic surgeon, and she practices in Gurgaon. So if anybody wants to look her up. I think she's absolutely remarkable. So thank you for being here.
Thank you, Asad, for inviting me and for all those kind words. Thank you very much.
Right. So, because we are a little pressed on time and I would not want to stretch this any further, I would want to ask questions, and I want to go in a way so that we follow the regular life span of a human being, like chronologically. So why don't we start with teenage, For teenage girls, how do we know whether irregular periods are normal puberty changes or early signs of PMOS, as the name has changed very recently. It was PCOS, now it's changed, and thyroid issues and hormonal balances. How does one get to know what are the signs and symptoms of if some girl is trying to figure it out for herself? What should she look out for?
So first of all, in the beginning, when a girl attains her menarche or when she starts her periods, the periods are irregular. The periods could come early, they could be delayed, they could be lesser, they could be more. This is perfectly normal. But in case this irregularity persists beyond 2 years, or in case she doesn't get a period for more than 3 months, or she is getting an associated acne, or maybe, increased body hair, scalp hair thinning, or maybe abnormal weight gain without any obvious reason. Now, these are the red flags and they should be definitely investigated. We should not say, maybe 3-4 years is okay, but then beyond 2 years, we should definitely investigate. And of course, because, the entire story of the periods, I always tell to my patients also, it starts in the brain. There's something known as hypothalamic pituitary ovarian axis.
Right.
Hypothalamic pituitary ovarian axis. So the hypothalamus produces certain hormones which act on the pituitary. Now the pituitary produces certain hormones which then act on the ovary, and now the ovary ovulates, produces estrogen and progesterone, and that act on the uterus to finally cause periods. So if there's something wrong up here, which could be as simple as stress, worry, anxiety, lack of sleep, that also could disturb the periods. Somebody is having a thyroid issue, somebody is having a high prolactin, which is a hormone which is produced from anterior pituitary. So in case there is any kind of dysfunctioning happening in the upper story,
Right.
that could also impact the periods. So the bottom line is that for all mothers who are, taking care of their daughters or worried about their daughters, in case the period irregularity persists beyond 2 years or the periods don't come beyond 3 months, it is definitely something which should be investigated.
Right. So, when you were talking about that, I've seen a lot of people just get prolactin done. First thing they get up in the morning, and then that, they see a huge spike, and then they send it to their doctors. Sometimes we've seen that with some of our clients and patients as well, and then they're just put onto something like cabergoline or something like that, right? So, could you tell our audience what would be the right way to get a prolactin test done?
Yes, that's very important. I'm glad you asked this question, especially in today's culture when getting a test is so easy. You just have to call a guy and the person comes and say, "Oh, ma'am, iske saath ye package hai." You get another test also done. So you get a prolactin done. And now the prolactin comes to 60, maybe 100 or whatever. And you send that report to a friend or whatever, and they start you on a medication. Absolutely not right. So it is very, very sensitive to the diurnal rhythm.
Right.
So the best way to do a prolactin test is 10 hours fasting, 3 hours after waking up. And the best is actually you take 3 samples at 15 minutes interval, take an average of that. This is known as pooled prolactin. In case the pooled prolactin comes high, now we need to find out why is it high? Why is the pituitary gland producing more prolactin? There could be many reasons for that. So we investigate on those lines. So randomly just getting a prolactin test done and then randomly starting a tablet is not a great idea.
Yeah, that's a common error I've seen. So, I'm glad we discussed that too. So now PCOS is now being discussed as PMOS, right? So a metabolic and a hormonal condition, not just a cystic ovarian problem.
Yeah.
What's the difference? Why is it being perceived differently, and why is this shift in name?
Asad, this is something which we've been talking for last more than 7 to 10 years. I've been speaking about this on our channels, Maitri, ki bhai, PCOS is not just a problem with the ovary. It's actually a misnomer. Actually, it's the poor ovary which is bearing the brunt of something going on deeper inside. It is just the tip of the iceberg. There's a lot which is going underneath and which is not just affecting your ovaries or your periods or your fertility. There is more at stake. The problem now we know, of course, is the insulin resistance, which leads to weight gain, which leads to, many other hormonal disturbances, abnormal cravings, and then because of that insulin resistance, the insulin levels go up, which is called medically hyperinsulinemia. That in turn stimulates the ovary to become bulkier, and that produces androgens, which are male pattern hormones, which lead to acne and all those male pattern symptoms. Like, a man would have more hair on the face
Right.
or on the body and less hair on the scalp. So now the women also follow the same pattern. They start losing hair from the scalp and they start getting more hair on the body.
Right.
So if we try and treat our acne with some topical creams or, treating your hair fall with a fancy shampoo,
Right.
then we are not going to lead anywhere. And by the way, there's nothing called a hair fall shampoo.
Right, of course.
And I'm saying this on record.
Right.
Okay, there is nothing called a hair fall shampoo or anti-breakage shampoo or some shine shampoo.
Yeah, I know all about that. I've tried the whole thing. 100% true. Yes.
So the point which I was trying to make was your skin and your hair, they actually reflect what's going on deeper inside your body.
Right.
Unless and until you fix that, your skin won't improve, your hair won't improve, your weight won't improve. And now, thankfully, we know that the problem is insulin resistance. Thankfully, now, because of the new terminology, now we have a better term, which is called PMOS, which is polyendocrine metabolic ovarian syndrome. So polyendocrine means multiple level endocrine systems are involved. Metabolic means that there is a metabolic dysfunction. This is how the metabolism, functions in the body. So at the core level, that is not functioning right. And of course, there's an ovarian angle to it, irregular periods, infertility, and a lot of other issues. So It's it is high time that we start viewing this condition as a whole body condition and not just a problem of the ovaries or the skin or the scalp.
Right, absolutely. Just a question that, because when you were telling me about all of this, I somehow connected a couple of dots. Uh, Pardon my curiosity if I come across any other way. Just to, to speak to some women who want better shaped bodies, who want to look, look better in general, besides the skin, but also at a physique level or a body level. Do you think that visceral fat plays a role in the kind of hormones your body is secreting, or it interferes with the functioning of your ovaries or the functioning of your endocrine organs or glands, so to speak? Do you think one must look out for it and try and minimize it as much as possible?
100%. So today we don't just talk about weight and BMIs. There are better markers of metabolic health
Yeah.
than just weight and BMI. So we talk about visceral fat. So there are some good fat, there are some bad fat. So the fat which is encased inside your abdomen, which wraps around the internal organs. I, as a surgeon, know because we see it every day
Right.
inside.
That's why I asked you that question.
So this is something which is directly related to your metabolic dysfunction. This is known to be the cause for your prediabetes, diabetes, hypertension, dyslipidemia, cardiovascular, health, everything. So nowadays we have some fancy markers also for this, right from clinical markers to some fancy body analysis markers also. So I really feel, in fact, there's a term called TOFI,
Right.
thin outside,
Fat inside.
fat inside. And I really feel thin people are at a bigger problem because they think कि मैं तो छोले भटूरे खा सकती हूँ, मैं तो रोज रसगुल्ला खा सकती हूँ, there is
Yeah.
no problem.
Yeah.
But what they don't understand is that even they can be having a altered fat and a muscle ratio inside. In fact, that's the reason how lean PCOS, and now probably we'll call it lean PMOS, also happens.
Right.
Because they have an altered fat and a muscle ratio
Yeah.
in the body.
Correct. And, they did this experiment on rats. I don't think this would be approved on humans, but what they did was they took some fat and they injected it at a subcutaneous level on certain mice. And they saw that they immediately became more insulin sensitive because subcutaneous fat was actually protective, and there was some place for all of that extra to go to, to get disposed of, and not interfering with your organ systems or your glands for that matter. And because fat as a molecule also proliferates
Yeah.
and interferes with, let's say, at a pancreatic level with beta cells, right? So then cell to cell messaging, functioning, and all of that also gets impaired. So I think
100%.
yeah, I think one must definitely. So it's, my thought was validated from that. Okay, so when is period pain not normal? Like, when does one know that it's endometriosis, and when does one know that it's just a bad cramping situation? Like, what's the distinction?
So first of all, let's understand why do women get pain during periods. So the periods are nothing but the shedding of the lining of the uterus, which
Yes.
is called endometrium. So the uterus has to contract to push that lining out. So in that process, there's a chemical which is released called prostaglandin, which
Yeah.
makes the uterus contract so that the uterus is able to push that lining out. And that prostaglandin then causes pain. So little bit of pain is perfectly normal. On day 1, day 2 of the period is perfectly normal. But in case your pain continues for all 5 days, in case you need to take a painkiller regularly all 5 days, in case your pain is not going away after your periods have stopped, in case you have painful bowel movements during your periods, in case there is pain during intercourse, in case there is nausea, vomiting during periods. Now, these are signs that there is something more to that period pain. The reasons could be many. There could be simply infections, which is very easily treatable, to a significant problem like endometriosis and then fibroids and many other things. So the point which should be made very clear to every woman is little bit of period pain is absolutely normal. Perfectly all right to take a painkiller. I've seen that also. People say, no, 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 I don't take a painkiller. So you don't have to become a martyr. Please take a painkiller.
Yeah.
But please understand, in case you need to take a painkiller all 5 days, please get it investigated as soon as possible.
Right, 100%. And speaking of painkillers, is there any specific one that one must take, and any particular one that they must avoid, which might, you know,
Nothing like
nothing?
that.
Okay.
Any painkiller which works for you, it could be simply as simple as a paracetamol, as maybe a combiflam, maybe a Drotin, maybe a mefenamic acid, anything. Any painkiller which gives you pain relief
Right,
is perfectly fine.
right. I asked that because there was this one woman who
I know.
asked me if is it okay if I take Ultraset, and
Ultraset is fine.
Ultraset is fine. Okay.
There was a lot of controversy about Meftas pass in between.
Right.
So I would say start with the simpler things like a simple paracetamol, simple combiflam, maybe a Drotin. But in case you need to take a painkiller all 5 days, 3 times a day, and you have associated symptoms, please get it investigated, because endometriosis is real. Fibroids are real, and by the way, fibroids also can cause a lot of pain. So, and sometimes even simple things like somebody's having a simple pelvic infection, somebody is wearing a copper T, that also can cause pain.
Right.
So there are very easy treatable things, while there are some which require a long-term management protocol.
Right. So, for women, now let's go into the next phase of the life that a person goes through. So, for women who are in their 30s, if they're planning a pregnancy, because these days there's a lot of that, pregnancies are people are having kids much later. I think that's the general trend when, we have a very educated society in general. So, that's a common trend that, we've observed. So, what should they look out for? Like, is there something that they should get checked first? Egg quality, hormone function, or stress, or something like that? Anything particular that they should get tested for first?
Yeah. So first of all, the clear message which I want to give to people is that have a baby only when you are ready for it.
Yes.
Not because your husband, your parents or in-laws or the society wants you to have a child.
Right.
When you are physically, mentally, financially, emotionally ready to have a child. That's very, very important. Yes, of course, today there's a paradigm shift in the society. Today women are into their careers, they're studying, or maybe, they just want to delay the pregnancy for whatever reasons. But then, till that time, what's happening in the body? See, we need to understand that biologically, we were made for a different kind of a planning of pregnancy.
Right.
We were designed to be pregnant earlier. We were designed, by the way, the best age to have a baby medically was early 20s.
Right.
That's when your egg reserves are the best, you have the better quality eggs, you still haven't developed diabetes and hypertension, so many other problems. So that's the best age. But today we know that, you can't afford to have a child so early. So then what do we do? So number one, make sure that you are physically healthy till the time you reach your 30s or 35 or 40.
Right.
Make sure that your weight is in the optimum category. Make sure that you don't develop diabetes or hypertension. You look after your metabolism or metabolic function or insulin sensitivities very, very carefully.
Right.
And of course, there's a test called AMH, anti-Mullerian hormone, which talks about the ovarian reserve. So what is ovarian reserve is that every girl child is born with finite number of eggs.
Right.
Unlike men who continue to produce sperm till later age, women are born with their lifetime supply of eggs at the time of birth.
Right.
After that, it just goes downhill. So in case you're planning to wait for a longer period of time, get your AMH tested. It's a simple blood test. Doesn't need any kind of a preparation. It's a simple test. Maybe get an ultrasound done on second or third day of the periods. It tells us how much is your ovarian reserve. And it's a good idea to go for your egg freezing. Medically, we call this as oocyte cryopreservation. So it's a very good idea in case it's like a plan B for you. You know, if by 40 you feel now I'm ready to have a child, and by then your ovarian reserve has come down, at least you have a backup with you.
Right, right.
And of course, visiting a doctor is very important, that you
Yes.
get yourself tested, you make sure that all your labs are right, your weight is right, you're not suffering from any major problem.
Right.
So look after yourself.
Right, right. And then once you're into pregnancy, are there any particular symptoms that one must be aware of, like, bleeding, swelling, blood pressure, uh, diabetes, and all these things, that happen, gestational diabetes, back pain, breathlessness? What about during that period?
So fortunately, pregnancy is a time when people are already, very, very, thickly into it. Oh, I'm pregnant now. I have to be doing this. I need to be eating this. I need to be doing this. But unfortunately, still, people don't follow the right kind of nutrition protocols. People don't really sort of do exercise. When we tell people to exercise, people look at you. Oh, should I exercise in pregnancy? So that's different. And of course, all those things, like you said, bleeding, swelling, breathlessness. Now, these are, any pregnant woman would know
Right.
that bleeding in pregnancy is abnormal.
Of course.
So, anytime if you have bleeding in pregnancy, obviously this is not normal. The reasons could be very simple, from what is known as a subchorionic hemorrhage to something very serious like a miscarriage or an ectopic pregnancy or a placental issue. Similarly, for breathlessness, little bit of being out of breath in pregnancy, especially when you are in your late second or third trimester, is
Yeah.
perfectly normal.
Yeah.
But in case it's associated with high blood pressure or maybe some, cardiovascular issue, this should be investigated.
Right.
So I think the message should be that please follow your doctor's advice, go for your antenatal checkups regularly,
Yeah.
follow a good diet, follow a good exercise regime, unless and until your doctor has specifically told you not to do certain things.
So, what are the safest ways to, let's say, support your pregnancy? So, you said exercise, nutrition. So, maybe just 5 points that how does somebody make their journey through pregnancy as smooth sailing as possible and avoid problems in general?
Okay. So number one, I would say, is preconception planning. That starts before you get pregnant.
Right.
So make sure that you visit a doctor beforehand. The doctor is going to ask your history, suggest you, proper supplements, get yourself investigated in case there are certain medicines to be changed. For example, somebody is taking some anti-diabetic drug, which is not safe in pregnancy. So that visit is very, very important.
Yeah.
So number one, starts with that. Then second, most important as a doctor and as a obstetrician, I know we have lots of myths and superstitions about the diet. It spreads across all kind of cultures. Somebody would tell you you should eat now double. Somebody would tell you that you should have lots of milk or coconut so that you have a fair baby. Or I mean, the list could be endless.
Right.
It's endless. So please, use your logic and talk to a proper nutritionist, talk to a proper gynecologist. And please remember that in pregnancy, you're not supposed to eat double at all, at all. Even in the last trimester, if you increase your calorie intake by 500 calories, it's great. उससे ज़्यादा खाने की ज़रूरत नहीं है. Most important thing is that you need to be careful about, eating right things, which may be, good protein, good fiber, good complex carbohydrates, good type of fats. That's very, very important. Make sure that you're always sleeping well.
Right.
In today's culture, modern culture, where sleep is the first thing people sacrifice.
Yes.
Today with the Instagram and Reels and socialization and Netflix and what all, people don't sleep.
Right.
And I plead to patient, bhai, please sleep.
Right.
Because that's the time a lot of resetting happens in our body, and which is very, very important for the pregnancy. So number 3, sleep.
Right.
Obviously, you need to exercise.
Right.
Now, when I say exercise, this is something which is, all scientific bodies approve. They say 150 minutes per week of moderate, consistent exercise is recommended. And I feel it is the bare minimum.
It is a bare minimum.
150 minutes to बहुत bare minimum है. This for especially the kind of cultures which we lead now. People are practically sedentary.
Right.
You need to be doing more. Please exercise all 7 days. You eat all 7 days, so please move your body all 7 days.
Right.
Move your body at every opportunity. Think, how can I move my body more?
Right.
And of course, follow your doctor's advice, go for regular checkups. I think we did 5.
Yeah, 100%. On the exercise bit, I would just want to add that, always have a professional who's aware about your situation.
Yeah.
Because,
Very important, yeah.
I've seen people just start exercise and, they go with some random
Yeah.
trainer lying on their backs, full blown belly with
Yeah.
visceral fat. And I'm like, I wouldn't do that because, barely anyone knows. Like, you don't want that compressed inferior vena cava,
Yeah.
right? And so you just want to go to a professional in general.
Yes, and ask your doctor first. Obviously, somebody is having some bleeding or high blood pressure or whatever. So we are talking about uncomplicated, low-risk pregnancies, and it's great to exercise. And I'm forgetting, who was that? There was that woman called Serena Williams.
Yeah.
So she won her French Open when she was 12 weeks pregnant.
Oh, wow.
So she was 3 months pregnant.
Wow.
And how many matches would she
Yeah.
have played
Right.
before that?
Right.
So it's and I've personally seen women 9 months, full 9 months in headstand.
Yeah, yeah.
So it all depends, of course, your stamina, your pre-pregnancy strength levels and
Yes.
everything. But please remember, it's good to move your body.
Yes.
Like, please, at every opportunity, think of moving your body a lot.
Yes, yes. 100%. And I think exercise is tough. It is tough because it's a hard thing to do.
Yes.
But many things in life worth having are.
Yes,
So
100%.
having a child is not easy, right?
Yeah.
Giving birth is tough. And I think going through life in general, you're getting married into another family and all of
Yeah,
that,
yeah.
that's also tough. So
Yeah.
I think Indian women are strong. And I think they can definitely do that exercise. I think many of them underestimate themselves. They say that,
No,
what?
women are strong.
Women are very strong.
Yes.
Right. So, okay, so after delivery, how does one know, you have this loose skin? Is it loose skin or is it belly fat? How, because, in general, like what is women want to fix their bellies after that.
Yeah.
So what's the right way to sort of go about it in general? Like
See-
you have that diastasis recti and
know.
you can have maybe some scar tissue. How does one navigate that?
See, first of all, I really feel it should start with patting yourself. Oh,
Right.
I've delivered a baby. I've done a big job.
Right.
We need to understand for all 9 months, your tummy was stretched like that. So obviously, there's going to be loose skin. There was a big uterus, which has now, come to almost 12 week size. By the way, it takes about 6 weeks post-delivery for a uterus to come to its normal size, 6 weeks.
Wow.
Right? So there is a big uterus, there is loose skin because of the hormonal changes. There's a lot of edema here and there. In case you've had a cesarean section, there's a scar also there. And on top of that, there is something called as diastasis recti. So there's a lot which is happening in your tummy.
Yeah.
So let's just first applaud the tummy that you've done a big
Right,
job.
right,
And then,
100%.
of course, more than I think cosmetic, we need to give time to that tummy. And of course, do the right things, right from the nutrition, right to little bit of moving, not really worrying about your loose skin, giving it time for all the hormonal changes to settle down, for your uterus to settle down. Things like loose skin after the edema has settled, in case the loose skin is there or the stretch marks are there, they would probably need a professional dermatology, care, because once the skin has become loose, it's like a deflated balloon.
Right.
Now, for the muscle, obviously, a lot has happened there. Your pelvic floor has gone for a toss. Your deep core has gone for a toss. So we need a proper rehab protocol to fix that. The pelvic floor rehab, Even the diaphragm we have, even the, I'm not a physio, but whatever I understand, deep core muscles like transverse abdominis,
Yeah.
they also need a rehab. So a lot needs to be done, but then let's not just start it, 1 week ho gaya, how come my tummy has not gone in?
Yeah.
So just give it some time. Let the physiological changes settle down. And of course, discuss with your doctor, discuss with your nutritionist as to what kind of diet we need to follow. There is a breastfeeding angle to it also. We don't want your calories to go drastically down because you need to breastfeed your baby also.
Yes.
So we need to understand it's a process. We need to give some time,
Right.
maybe, 6 months or whatever. And I've seen people who regularly look after themselves by 6 months or so, they are by and large back to their normal self. Of course, things like diastasis require a professional, help there. Diastasis means that there were two recti muscles and now they've separated in order to accommodate the uterus which is
Space,
growing.
yeah.
So it's like a big hernia which has happened there, right? So
Right.
that needs to be fixed in a different way. Doing just random lunges or squats or whatever is not going to help.
Yeah.
We need to work at the deep core level. So a proper physio can guide you on that. So, like I said, let's go slow, go
Right.
steady, go scientific, go logical, be moderate, be consistent, and definitely you will see results.
Yeah.
And Asad, I always tell this to my patients. Have you ever seen an animal in a jungle fat after delivery? Just think of it.
Yeah. True.
A buffalo, cow, whatever, a monkey.
Right.
Have you ever seen them fat in a jungle after delivery?
No.
It's only a human being who becomes fat
Right.
because we eat a lot, we don't exercise. On top of that, we don't even breastfeed our babies.
True. True.
So, as the way the biology was designed, we were not designed to become fat after delivery.
Right. Right. Yeah, of course. Now, food, I don't think we have a food problem in general. Like, I will not see people, at least, I've seen deeper India with a lot of food insecurity. But in general, I think the whole, the food mindset that comes, I think it
You're
comes.
mistaken.
Really?
In the top educated lots, we see 10 liters of desi ghee being fed to a mother, laddus and mithai and whatever.
Yeah, that's exactly what I was saying.
Yeah.
That people tend to think that way. The reason for that, what I have sort of been able to sort of narrow down on with some evidence is that the older generation, they've seen a very scarce, famine-ridden India. They come from the partition
Yeah.
mindset. We see a very different culture in the south. They have
Yeah.
a very different culture. But towards the north, it's a lot of scarcity mindset, a lot of partition
Yes.
mindset. If anything happens, you've got to eat.
Yeah.
So eating has just become so overdone, and I don't think that we have that problem. Not what the scarcity problem anymore. That problem. I don't think anybody has that problem that they might not have food readily available or a food insecurity problem, because I think people just should be normal. Like, you don't need to overeat at all.
You don't need to overeat at all.
Yeah.
Yes, of course, there's a slight increase in the calorie
Yeah.
requirement because you're breastfeeding the child.
Yeah.
But you don't really need to overdo things
Yeah.
or eat a very, very calorie dense.
Yeah, your
food.
body is going to just ask for it.
Yes.
Like, after exercise, you just feel like you want to eat more. So I think that works.
Yes.
And the way people are nibbling these days and,
Yeah.
snacking these days, people don't know how many calories goes into what. Like, 2 peaches that the other day, a very close friend of mine, she said, how does 2 peaches have like 100 calories? That's just ridiculous. I said, that's weird to you. Check out nuts. Like, you
Yeah.
keep snacking on them. So, okay, cool. So, perimenopause, earliest signs, what should one look out for? What age does it happen? How does one sort of see it coming?
Yes. So perimenopause also, I feel, is something which is very normal. It's the part of transitioning into the next stage of life, and this is something which is not to be scared about, not to be villainized for everything which goes wrong in your body at that point of time.
Right.
And so, let's talk about menopause. Menopause means your menses pause. That's how the term has come. But before, and we label menopause as when you don't get a period for 1 year consecutively. 1 year you don't get your period, so we officially declare that you've gone into complete menopause. But 5, 6 years before is the time when the periods become irregular, when the ovulation becomes irregular, when the hormonal levels they tend to come down, which lead to symptoms like anxiety, sometimes mood changes, sometimes weight gain, and sometimes truncal obesity, pre-diabetes, and all those kind of things. So this is what is known as premenopause. And so most important is that you need to understand that this is number one, very, very normal. And this is the time when your body is changing. You need to be even more careful about the things which you probably never paid attention to in your earlier life.
Right, 100%. And you told me that you started exercise
Yeah.
at 47, right?
48, yeah.
48. So
Plus.
do you think that, that sort of, you knew about how this goes, there's drops in estrogen, osteoclast activity goes down, out of whack. So uh, uh, osteoblast activity goes down, osteoclast activity remain. So do you think it is imperative to do strength training?
100%, 100%. Like, we need to understand the most important thing in your body today is the most important insurance in your body is your muscle.
Right,
The muscle protection is something which is going to protect your metabolism. When we talk about osteoporosis, so there's a very nice explanation which my orthopedician once taught me. When you exercise, the muscles pull at the periosteum.
right,
Periosteum is the outer
Okay,
lining of the bone. And that pull on the periosteum stimulates the osteoblastic activity.
right,
So when you exercise, there's a lot good which happens in your body.
right,
That's how the osteoblastic activity goes up. That's how your blood sugars, your pre-diabetes, your insulin sensitivity. So the only thing which a woman can do and should do is to make sure that she has a good muscle mass. Unfortunately, we don't give it much importance. And this is something which we all have to learn, that
Yeah.
muscle preservation
right,
is very important. In fact, this is known as sarcopenia, which is like every year you lose about 1% of your muscle mass from the age of 30 years onwards.
right,
So the damage starts to happen much earlier, before the menopause.
right,
We blame menopause for everything,
right.
but nobody blames their lifestyle.
Yes, 100%. And for women after menopause, what health risks become real, you know?
So there are some which are real, like osteoporosis and like cardiovascular risk. Why osteoporosis? Is because estrogen is something which protects your bone. This is something which is responsible for the osteoblastic activity. Estrogen is something which protects your heart also. These are like two important risks, serious risks which a menopause can cause. Then there are certain other symptoms, like somebody might get night sweats or vasomotor symptoms, your skin changes, your mood changes, anxiety, sleep issues, vaginal dryness, all those things. They are there, they are significant. But the real issues are osteoporosis and increased cardiovascular risk. So once again, exercise is the most important thing, because it takes care of your heart, takes care of your bone, takes care of your mood, takes care of your sleep, takes care of your metabolism, diabetes, pre-diabetes, then of course right nutrition. And nowadays we talk about HRT. HRT, we have clear guidelines from our scientific bodies. After, any time a woman gets, so there are definite guidelines. I
Yeah,
would
yeah.
not really want to go into the specifics of it.
Yeah,
And in case your symptoms are not, getting control, in case your DEXA scan is showing that you are osteopenic, then HRT is definitely worth considering. Please don't get scared about HRT. And we always do a complete check
Yeah.
who's the right candidate for the HRT,
Yeah,
and
yeah,
then
yeah.
prescribe the patient an HRT.
I'm assuming that's also because why there are such strict guidelines, because it's so casually thrown around,
Yeah,
because
yeah,
people
yeah.
are like, you have this, consider HRT. My doctor in the US did it. She's okay with it and all of that. I'm assuming because a lot of breast cancer is also associated with estrogen.
Yeah,
You have the selective estrogen receptor modulators as a
yeah,
treatment protocol. So
yeah.
I think that's why. Is that why this is?
So we need to understand that there are differences in various, you know, various places. Like what works for a
Yeah,
US
yeah,
woman might not work or might not be applicable to our women. There was a paper I read which said that the incidence of menopausal symptoms is much lesser in Indian women as compared to women in US or somewhere. Probably our diets are to be, we need to be thankful to our diet.
yeah.
There are a lot of things where we get phytoestrogens from.
Right.
So that's one part of it. But the sad part is that we are not physically active as they are.
Yeah, yeah,
So we need to be taking only good things from them
yeah,
and then be happy with what kind of diet we also have.
yeah,
Like the lentils and all, even the tea, you know, this is supposed to be, having good amount of phytoestrogens. So
yeah,
there
yeah,
are good things also in our diet.
yeah, yeah. Many good things. So yeah, I think that sort of sums up whatever I have as questions. If you want to ask a couple of questions, you can just feel free, and then they can.
Okay. So, Asad, I want to know certain very basic things, very basic things.
Okay.
We nowadays there's a buzz around strength training. I think I also spoke about strength training in my previous, so many questions. So, please explain what is strength training, number
So
one.
we would classify it as resistance training, right? And essentially, it is your body's ability to generate force, right? And strength training and or resistance training would be anything that allows you to overcome certain amount of force. So like if whether it's a dumbbell or a band, or even if it's your own body mass, right? For instance, if you're squatting or doing push-ups on your knees, you are acting against a certain force. And usually it's gravitational. With bands, it's of course elastic. So, but what it tends to do is it stimulates certain processes in the body that your body wants to overcome and become more prepared for by increasing muscle mass, by increasing bone density, so that the infrastructure or the makeup of your mechanical structures, so to speak, in your body, they are capable enough to do it. So you're giving your body a signal, okay, I'm going to be doing these activities, and they remain valid for as long as you do them regularly. That's why it's a consistency. There's a consistency aspect to it. It's not like you just do it once, build a lot of muscle mass. If you leave it, you will atrophy, you will lose all the benefits of it. But you're constantly telling your body that this is the amount of force that I should be used to generate, and therefore I must have this said amount of muscle mass and this kind of bone density and these kind of metabolic processes as well. So let's say I'll go a step further and talk about why the muscle aspect of it also is very important, because what's happening at a metabolic level is that your body is also prepared to have glycogen reserves to be able to generate that force and keep doing it, because that's where all the energy is sort of coming from. So if you're exercising, your body is smart enough to send some of it into muscle as glycogen reserves, increase that muscle mass so that you can have more glycogen reserves as well. That disposes blood glucose very effectively. So anybody who has like a diabetes problem or a metabolic problem, strength training is very good at fixing that, because the entire hormonal milieu of your body, whether it's estrogen, testosterone, they also are signaled through the hypothalamus that, okay, you know what, we will need more uh, uh, participation from your end. We would need more testosterone. We would need more of these hormones in adequate numbers. So your LH sort of, modulates that and produces it, and therefore the entire conduct of the body, whether it's at a metabolic level or at a mechanical level, just becomes better, because the human body was designed to be doing all of these things. I
Yeah.
think that's how biology is.
So tell me, what should be the goal? Like, how do I know that I'm doing it right? Like, what is the maximum level, or what should I aspire? Like, for example, if I'm doing a strength training, what should be my aspiration? So, are there any markers that for a teenage girl, for a young, for maybe a middle aged girl, for a woman of my age, what is it that I should aspire for?
So we have some literature which quantifies, I think, knee extensor strength or grip strength for that matter. Um, and grip strength is just a proxy for overall strength.
How do I know whether I'm doing it right or not?
So then that
or-
has to be measured. So
Achha, that has to be
that has to
measured.
be measured. So I've seen a lot of people doing a lot of workouts and exercise, but with
Results.
no result and also no context. Like, if I want to reduce, let's say, LDL particles, they have to go below 100, right? But if I bring it down from, let's say, 160 to 150, how much of a cardiovascular risk has
That
it
could be
reduced?
lab error also.
Right? It could be. So, to be honest, you should know where you stand, and there is no upper limit of benefit.
Oh, there is
Yeah,
no upper limit.
there is no upper limit of
So,
benefit.
which means that you start from 0.5 kg weight and you can go up to 10 kg weight.
Yes, as long as all of it is done naturally,
Huh.
as long as all of that is not interfering with sleep, stress, social connections. Like, what we've seen is some people tend to isolate themselves and just go into, okay, I'm going to be an exercise person and a diet person. Then that interferes with their social life, because that also leads to a better quality of life and extended lifespan. So as long as all of those things are fine, there is no upper limit
No
of benefit.
upper limit.
Yeah.
And women of all ages must exercise?
Women of all
Starting from
ages.
teenager
Yeah.
to a menopausal or an 80-year-old woman also?
100%. So,
That's a very important message. I think that is the biggest take-home message, that every woman must exercise and move their bodies.
yeah, and as opposed to popular belief, a lot of people think that you can't gain muscle mass when you're older. That's untrue. Yes, there are fewer hormones that will sort of make it very conducive for you to gain muscle mass, but it's not limited to just testosterone, so to speak. There are many other ways at a cellular level. You have your sarcoplasm, which expands. There are many processes: mitochondrial density, mitochondrial size, all those things. In fact, down to your mitochondrial enzymes with phosphofructokinase and ATPase and all those things, they all help in cellular remodeling and building. So you can gain muscle at any age, but the earlier you start, the better it is, because it's like wealth.
Yeah,
You
it's
know,
like wealth.
yeah, you
It's your
got-
insurance.
Yeah, you just have to have a good baseline reserve, and then you will have a decline, but it will be much lesser.
How frequently should it be done?
At least 2 days in a week.
At least. This is bare minimum.
Upper body, lower body, 100% at least. And it should be comprehensive. So when we say comprehensive, it should be in all planes. So I would say vertical push, right? Horizontal push, horizontal pull, vertical pull, and then your lower body. So your lower body should be focusing on your ability to at least go down on the ground and getting up with force. So a simple exercise would be a full squat all the way down to up with some resistance. And if you're able to do that, then you're mostly covered with all activities of daily living.
Wow.
Because we've run it through, like, let's say travel, you want to pick something up from the top, you want to pull something, you want to hang on to yourself and protect yourself from falling, which is 80% of accident related deaths.
Yeah.
You want to get up from the ground, not be on a wheelchair, it covers it all. So at least 2 days, and you can do it 6 days in a week.
Okay, one last question.
Please.
I don't know if it is right or wrong. Do you really need to take a protein supplements when you do strength training?
So protein is definitely important as a macronutrient, but if you want to increase muscle mass, you will need protein. That doesn't need to be a supplement. It could be from natural sources, as long as you're hitting at least a gram of your body mass, or your intended muscle mass into 2, I believe, right? Then I think you're in a good place.
Okay.
But if you were to strictly speak from a longevity standpoint, there's a completely different context to it, which is that as long as you have functional strength reserve, you are safe, you're fine. So that's distinctly different from sarcopenia. It's a concept called dynapenia, which is age-related loss of strength.
Oh,
Right. And, a lot of vegetarians come up, some cancer survivors, who've shifted to an all plant.
I'm practically a vegan. I
Right.
just take little bit of milk in my tea.
Right.
So I'm also worried because, all my friends, they keep telling me, oh, you don't take a protein powder. Oh, you don't take a protein supplement.
Right.
So this is something which I'm sure, many people who are into this kind of a scenario would want to know, because there's so much of now protein marketing everywhere.
Yeah.
Now, is it right? Is it not right?
Um,
It's a very common question.
If you're diabetic, muscle mass is going to protect you, and you're trying to gain muscle, protein supplements is fine. In your case, maybe a pea protein, it's fine, because then you activate mTOR and muscle building is just faster. It's easier. If you don't have any, let's say, diabetes or other metabolic issues, and you have good strength, I think you can get away with it.
Okay.
You can get away with it, yeah.
Okay. Thank you.
Thank you. Thank you so much for being on this podcast. I think this was very enlightening for us as well as a team, and very kind of you to make time on a Sunday for us.
Thank you, Asad. It was indeed my pleasure to be talking about this topic, which really affects every woman. So I'm glad that we spoke about all these things, and I hope this will benefit many women. So thank you.
Thank you. Thank you.